Why did the Milwaukee County health officials feel that it was necessary to issue new restrictions and rules as opposed to just allowing business owners to make those decisions for themselves?
Yeah, so Milwaukee County, as other places across Wisconsin, have obviously made great progress in flattening the curve for COVID-19. But we felt like with regard to the national and state guidelines that have come out, that it's still really important to keep that measured, phased-in approach, where we're not flipping the switch quickly, but continuing to use that analogy of turning up the dial slowly. And our concern was that with the Supreme Court ruling and not having any measures in place, that one, the false perception that it is safe now to go and return to normal would be out there, but then also that there would be no guidelines and framework for businesses and activities to be operating on, to be operating under, to know how best to move forward with their own plans for reopening. So local health officials in Milwaukee County, the suburban communities, wanted to move forward in a measured way that parallels and is similar to the state's plan, but offers more forward progress in terms of reopening based on our own experience here in Milwaukee County.
Can you talk a little bit about the different distinctions? Like, so some, there is a wider reopening of retailers and things like that versus restaurants and bars.
Right. So again, we used some of the risk-based approaches that have been talked about in some of the business community sectors, as well as been talked about from the national level through groups like Johns Hopkins. And one of the things that is coming out of there is establishments like restaurants and bars are still very high risk settings where there's a lot of opportunity for transmission through shared food and that close proximity to one another. Whereas retail, again, with Governor Evers' forward progress on Monday, allowing 5 people per store, we felt like it was possible to go even a little bit further. So our local order offers a 25% occupancy for stores. That really bases the opening on the size of the retail establishment versus a somewhat arbitrary number. So again, as the stores look to the future, putting in place those physical distancing and safe business practice guidelines, but we felt like there were a lot of creative ideas for different retailers and retail owners for how they can implement those under these parameters. So we offer these safe business practices as guidelines to allow them to put those physical distancing measures in place. But we did feel like, again, in terms of a retail environment, that was certainly going to be possible for them and to keep their customers safe.
I know a concern for moms and dads, anybody with kids at home, has been, when can my kids go out and play? When can they interact with other kids or other families? Can I have play dates? Can they go to the playgrounds? Can you talk a little bit about what the guidance is for that for families with children?
Sure. I think families all have to make their own decisions based on what they feel comfortable with. That's first and foremost. That these guidelines and this information is really not telling people what to do. It's, again, offering parameters for how we feel it is safe to be out in the community. That being said, in terms of opening, so one element of this Milwaukee County order is that the playgrounds, especially the outdoor ones, would be allowed to be reopened. Again, looking at a risk-based approach, those outdoor environments are places where there's less likely risk of transmission. And the playgrounds offer both a place for kids to be physically active, but also for for people to take care of themselves, both mentally and physically. There's the caveat though, and as I mentioned, it's really up to each family to determine whether they're willing to accept whatever risks come with being out on those playgrounds. So those playgrounds are not going to be washed. They're not going to be disinfected. We would strongly advise that if kids are out playing on those playgrounds, that they come home, wash their hands before doing any other activities. And that if you see a lot of kids on the playground, really be thoughtful and make good decisions about whether it's a good idea to have your kid playing amongst so many other kids. So it will be really up to parents and guardians and families to determine, again, whether they're willing to go through it.
And then same thing for, like, if kid wants to go play at a friend's house or things like that?
Right. Yeah, these guidelines still put limits. Again, that kind of keeping under 10 would be the recommendation and what's in this order, so that there are still smaller groups that are coming together. Certainly would want to stay with recommendations that families are not intermingling, so that your group of 10, is multiple households, multiple family units, that you're taking smart precautions about how much exposure you want to open yourself up to. We know with our contact tracing, even now, as we've started to see people going to family events, that their inner circle of contacts is growing. And that is likely because people are starting to be out and about and intermingling. So on one day, socializing with one family and another day with another family, well, that now opens you up to that many more contacts and risks of exposure. So again, the point being that we should all still be cautious in limiting our exposures, even with these loosened restrictions.
Or keep tight circles, right?
Correct, yeah.
Um, Probably along the lines of what you mentioned before about flattening the curve and things like that. Governor Evers, in some of his remarks yesterday following the order coming down, said, we're going to have now, as a result of this, more illness, and we're going to have more deaths. Just to sort of challenge that, not so much that philosophy, but just to put the challenge out there, would we not have more deaths and more illness no matter when we lift some of these orders? I mean, there's not going to be a vaccine for months, if not longer. Whether we do it in 2 weeks or whether we do it in 2 months, won't we have to be willing to accept some level of continued illness and continued deaths?
Right. I think the point under flattening the curve is to keep the rate of transmission to be at a level where the hospital systems can manage the acutely ill. That is what we've seen with our data and hearing from the hospital systems, is that they are able to handle the capacity that may come with these loosened restrictions and those increased numbers of cases. But that's the delicate balance. So if we move forward with a quick approach where we open up everything and our caseloads increase exponentially, then again, that puts lots of pressure on the healthcare system. Whereas if we keep that slow turning up the dial approach, limiting our interactions, being cautious about our social distancing and when and where we're going out, we may and we will likely see more cases. But the offside of that is that hopefully we'll still stay under a threshold of fatalities because the hospital system is able to manage those who are acutely ill.
I bet you've heard a lot of the things that I have seen and read or heard directly from people on social media. As they look at the numbers and they see that hospital beds are in plentiful supply, that overrun or that surge that overwhelmed the system never quite materialized. We have an empty facility at State Fair Park right now that is ready to take 700 people if need be. So people look at those optics and they assume that the hospital system is ready to take on a surge or a spike if it comes. What is the evidence to the contrary of that?
Yeah, I think that the evidence shows that we've done a good job with the safer at home order and that we've flattened the curve. I think the evidence is also demonstrating that it is appropriate to start identifying where those opportunities are for loosened restrictions so that we can start to see what those impacts are going to be. We don't want to surge the system. I think that that's imperative. We don't want to see our loved ones in the hospital or die. So, it's a good time to start being thoughtful about the next phases of this pandemic in terms of reopening some aspects. But again, keeping our eye on those indicators so that we don't surge the system and overwhelm ourselves and the capacity of our healthcare system to take care of us, because that is certainly not in any of our best interests.
Since I have you, and I'll ask you one more question sort of along those lines too, that I've been getting a lot. What is your concern from a public health standpoint of all of the other things that have gone untreated for the last couple of months? I mean, we've been focused almost exclusively on COVID-19, but there are people who didn't get colonoscopies or didn't get mammograms or didn't have surgeries or things like that. As you look forward now the next several months, some other things are going to come up that we neglected over the last few months. What are your concerns from a public health standpoint about everything else?
Right. I think first and foremost, and we have heard this, are the mental health concerns of our residents, that there are a lot of people that are suffering the consequences of COVID, be it the financial or the physical or the loss of a loved one. There are just tremendous amount of mental health related uh, outcomes that are the result of this pandemic. And I think we need to really go back and take care of ourselves and take care of our neighbors, and to really put up supports for people that are suffering right now, be it depression or substance abuse, any of these areas. And that's both children and adults. So we need to also focus on our children and all of the things that have been disrupted in their lives. So really, for public health as well as our community, going back to some of the important areas of mental health so that we can make sure that everybody gets through COVID-19 healthy and well when we get to the point of having a vaccine.
So you don't necessarily think we'll look back and feel like in some cases as the phrase goes, the cure was worse than the disease, given that there are other new health conditions that have developed or worsened as a result of the strict lockdowns?
I think what we saw and what we will again, what we're still trying to make sure we don't experience is the tremendous loss of life from any potential surges. So I think that COVID-19 is still a really critical illness. It impacts people in so many different ways, and it is evolving. I still think this is the true disease of our lifetime that we need to be careful and vigilant about right now. But I think your point is well taken about making sure that we're protecting all of our community from the variety of health issues that we experience and address every day. So I think that both of them at the same time are critically important for both our public health and our healthcare system.